right, are we ready? All right, good morning, everyone, and thank you all. Thank you all for being here. Today, we're here to announce an update related to our ongoing COVID-19 journey, as well as share resources for residents to protect themselves this holiday season. Joining me in this effort, of course, are Chicago Department of Public Health Commissioner Dr. Allison Arwady, Chicago Department of Public Health Medical Director Dr. Geraldine Luna, and Humboldt Park Health Medical Officer Dr. Abha Agarwal. Though it's been a while since we've had a press conference discussing COVID, what I hope is in many of us, the virus still remains top of mind. We're not done with COVID because COVID is not done with us. This is especially true now as more and more people spend their time during the day and evening indoors to stay warm and spend time with their loved ones for holiday events and other festivities. Because of this, we felt like it was imperative to share an update on where we are as a city in regard to COVID-19 and give residents guidance so that they can celebrate the holidays safely. As of last week, Chicago and Cook County remain in the medium COVID-19 community level, according to the metrics that we follow from the CDC. Cases, as many of you have already heard, are on the rise in our city and nationwide, and we expect to reach the high level soon, perhaps as early as this week or next. And if we do, we won't be alone. For example, other big cities such as New York City and Los Angeles already went to high, and 43 counties in Illinois reached the high level last week. If and when Chicago and Cook County reach the high level, we will issue a mask advisory. And let me just underscore that, a mask advisory. And what that means is we will be asking all Chicagoans age 2 and older to wear masks in indoor public settings. Not only will this protect you, but it will also protect those around you, including some of our most vulnerable older residents and those with compromised immune systems. Preventing the spread of COVID now will also protect our healthcare system from being overwhelmed with COVID-19 cases. As you know, and you've heard me say over and over again since March of 2020, our primary concerns with COVID are making sure that our healthcare system can withstand any surge in cases, making sure that our healthcare workers and our first responders have the support and resources that they need, and making sure that we're taking care of our most vulnerable residents during the time of COVID. As I mentioned earlier, we know that many residents will be gathering for the holidays as well as staying indoors to avoid the cold weather. Warm indoor settings are the perfect places, unfortunately, for possible virus transmission, which is why we want to remind all of those gathering with loved ones over the next few days and weeks to enjoy each other's company, but do so safely. And the ways to do that are really simple. First and foremost, stay up to date on your COVID-19 vaccines. I am a living example of what happens when you get the vaccines and the boosters. I'm just coming a bout of COVID, and I literally was asymptomatic for most of the time that I was in my 5-day quarantine. The boosters help, and particularly making sure that you're eligible and get the Omicron booster makes a huge, huge difference. And again, I am proof positive of that reality. For most Chicagoans, that also means getting new updated boosters. That booster, as I said, is incredibly important. And if you haven't had a COVID-19 vaccine since Labor Day, that means you have not received that new bivalent booster, nor are you up to date on your protection against this virus. Still, everything that we're seeing in our city is Omicron, one variant or another. So getting this effective booster against Omicron is critically important. We urge you to get that updated booster, and that way you can enter the new year fully protected against COVID-19. And if you don't want to brave the cold, we are able to bring the vaccine right to your home for free. To make an at-home appointment for you or your family, please visit chicago.gov/at-home. That's chicago.gov/at-home, or call 312-746-4835, 312-746-4835, or just simply call 311 and say, I want that at-home vaccine that the mayor talked about. We can vaccinate as many as 10 people in a single at-home appointment, including those aged 6 months and up. And if you have a large household, larger than 10, we can book back-to-back appointments. Don't let travel or anything else be an impediment for you getting the vaccine, which again is safe, is free, and is widely available. Take advantage of the opportunity to get yourself vaccinated. Now, we can also provide the flu vaccine at the same time. And speaking of the flu, we're also encouraging everyone to stay safe by getting their annual flu shot. I got mine, and it's made a difference. The flu shot is available to everyone aged 6 months and older, and especially important for young children and seniors who are most at risk of serious illness from the virus. Every year in the United States, tens of thousands of people die from the flu. It doesn't have to be this way. I don't want any of our residents to be a part of this tragic statistic, which is why I'm calling on residents and their families, get your flu shot and avoid getting sick. It is widely available at pharmacies, at big box stores like Target. You can get it through your medical doctor, or you can get it through us, but make sure that you also get the flu vaccine, because we're seeing an uptick in cases for the first time since COVID hit. Now, aside from these vaccines, there are other steps that we can take to protect ourselves and our loved ones. For example, consider taking a COVID test before gathering with family or friends. COVID tests are still widely available. You can get them for free from the federal government. Just to be on the safe side, take that COVID test before you go to your holiday party, your Hanukkah party, Kwanzaa, Christmas Eve, Christmas Day, New Year's Eve. Just take that test to give yourself that extra little bit of confidence that you are not sick with COVID. Because as in my case, you can be asymptomatic and not know until you test. As a reminder, free COVID-19 tests are available by the U.S. mail, and each household is eligible to receive 4 tests. Take advantage of it. And to get your COVID test, contact covidtest.gov or call 1-800-232-0233. That's covidtest.gov, G-O-V, or call 1-800-232-0233. We also encourage you to wear high-quality masks in crowded settings or during travel, like this one, a KN95 mask or some other kind of high-quality medical mask that is going to block the transmission. Wash your hands frequently. Improve ventilation in your home by simply cracking a window. And most importantly, stay home if you are sick, even if you're vaccinated. If you're not feeling well, don't feel like you're being a hero or courageous. Stay home. Take care of yourself. Don't go out into the world. Save yourself and save your work colleagues and anybody else that you might come into contact with. These little steps, each and every one of them, add up to protecting ourselves from COVID, from the flu, and other illnesses ultimately that affect our health and well-being and those of our loved ones and our neighbors. And now, speaking of health and well-being, I also want to take a moment to talk about the winter storm that's approaching our city today. Luckily, some of the dire predictions and forecasts that we saw from modeling earlier in the week, we don't believe are going to play out. But snow is coming, and importantly, frigid temperatures and high winds. So we want to make sure that you are prepared. As a city government, we are very much prepared. We've got salt trucks out. They've been out since last night. We have warming centers that are going to be available. We want to make sure that we, in the true spirit of Chicago, are looking out for each other and looking out for our neighbors. If you know there's somebody in your network, a senior, a vulnerable resident, or just somebody who's disconnected, reach out to them. Make sure that they've got the provisions that they need, food and water and shelter, but also just reach out and make sure that they know there's somebody who's looking out for them and has their back. those are the important things that we must do as Chicagoans. We can talk more about that in a question and answer, but I feel like we've got a very good plan for dealing with the weather. Take care of yourself. Don't go out unnecessarily. If you don't need to be out, certainly once the temperatures start to plunge later today and tomorrow, don't go out. Stay home. But for now, I'll turn it over to Dr. Arwady to say a few words. Dr. Arwady.
Thank you, Mayor. I continue to feel lucky to do this job in a city with a mayor who follows the data, continues to really pay close attention, and wants to make sure you're all getting the most important messaging related to COVID. So first, I want to thank Chicagoans and highlight some really good benchmarks as we come to the end of this year. I'm pleased to say 2 years after COVID vaccinations are available in Chicago, 5.6 million COVID vaccinations have been administered. We have 2.7 million Chicagoans, so that is more than 2 vaccines on average per Chicagoan. That's excellent, and I want to thank everybody who has had a COVID vaccine. I also want to highlight an important benchmark that we have just hit 500,000 of the updated COVID vaccine bivalent boosters. That's the vaccine the mayor was talking about that's updated for Omicron. If you have not had a vaccine since Labor Day of this year, you're not up to date and you're not as protected against Omicron as we need you to be this winter. So thank you to the 500,000 Chicagoans that have already gotten that updated booster this fall. That represents 20%, though, of our adults, 1 in 5, and less than 2 in 5 of our older adults. That's well above national averages, but it's not enough. So the number one thing I want you to hear is that if you have not had a vaccine against COVID since Labor Day, you need to get that now. Make it a holiday present to yourself. Just to emphasize a little bit of data behind what the mayor shared, last week, 9% of U.S. counties in orange on this map were at that high community level already. That does include both New York City and Los Angeles. And about 35% of counties, including Cook County and the city of Chicago, were at the medium level in yellow. You can see there already are many counties in Illinois that are in orange or at a high level, and many counties across the U.S. If you are traveling to one of these counties, you should wear your mask in indoor settings. We do remain at the medium level here in Chicago. This is calculated every week with a combination of looking at the number of COVID cases diagnosed in laboratory and hospital settings, the number of hospital admissions, and the percent of hospital beds taken up with COVID patients. I do expect that over these next couple of weeks, we probably will move into high. And as you heard, you should put your mask on in indoor settings if and when that happens. I also want to highlight some data that we continue to update regularly on our COVID dashboard, chi.gov/COVID-Dash. I've shown you these graphs, but let me just highlight for you what they mean. So this is just Chicago data. In the red line, we're looking at positive COVID tests for Chicagoans who have never been vaccinated. There's not very many of those folks left, but that's who we're talking about. The light blue line are people who got their original vaccines, and the dark blue line at the bottom are people who are up to date, have had their vaccines and their boosters. High here is worse. So you see that the red line is higher. That really big peak was last January. But even right now, on the right side of that slide, you see that red line ticking up? Those are unvaccinated Chicagoans who are more likely, and in fact, nearly twice as likely as Chicagoans who are up to date, just to test positive. It makes a difference if you've been vaccinated. It makes more of a difference if you've had that booster. But when we look at the serious outcomes, this is when the data is even stronger. Let's talk about hospitalizations. Again, the red line are unvaccinated Chicagoans. That middle blue line are those who were vaccinated originally, and then the dark blue line at the bottom are those who are vaccinated and boosted. And so the mayor, who is vaccinated and boosted, had very little symptoms when she just had COVID. If she were unvaccinated, her chance of being in the hospital with COVID would be 3 times as high, 300%. That's huge from a medical perspective. And you can see that even right now, this is regardless of whether people have had COVID before. This is regardless of their underlying conditions. This is regardless of their race, ethnicity. You can cut your risk of ending up in the hospital with COVID to a third just by being up to date with your vaccine. Don't take that chance, get up to date. And the last piece of data I wanted to highlight is around deaths. As we head into this holiday season, I do just want to take a minute to reflect and remember that 7,968 Chicagoans have died from COVID-19. And I know that most families in Chicago have been directly or indirectly impacted. I know that there are empty chairs at holiday celebrations. I'm pleased that we have the tools that can help keep these numbers down close to zero. We are averaging much less than 1 death from COVID-19 in Chicagoans per day. But the number does continue to grow, and COVID-19 remains a leading cause of death for Chicagoans. So please come up to date. Everybody over the age of 6 months should get this COVID vaccine. Finally, on influenza, there is a lot of illness going around, as you likely know, especially if you have children. There's a lot of influenza, there's a lot of RSV and other respiratory viruses. This, again, is Chicago data for emergency department visits. And I want to highlight that influenza-like illness, meaning children coming in with likely flu that we're waiting for test results on, we are seeing emergency departments being hit very hard with our youngest children. That top line is 0 to 4-year-olds, followed by 5 to 17-year-olds. Influenza hits young children really hard. This is not the year to skip a flu vaccine for anybody, but especially for our youngest children and then for anybody who's older. Please, we don't want people hospitalized. We don't want people dying from influenza. As a reminder, if you do catch COVID-19, you must stay at home for 5 days. Then if you're feeling better, you can be out in days 6 through 10, but you must mask in all public settings during that time period. If you're gathering for the holidays, as you heard, a great idea is get tested to help protect your friends and family before you gather. You can get free at-home COVID tests by visiting covidtest.gov. I also want to remind you that all insurance companies are required to cover free of charge 8 COVID tests per individual per month. So you are able to get those COVID tests over the counter at the pharmacy, to order them online. Your insurance must reimburse you. And for those with Medicare, often you're able to just pick them up at the pharmacy. We have them widely available. CPS has been distributing them. Make sure as you're planning ahead for potential COVID, you have at-home COVID tests. You can also call 1-800-232-0233 and free COVID tests will be sent to your home. And finally, emphasizing the at-home for the holidays aspect of our Protect Chicago at Home. As the mayor mentioned, we are, I believe, the only large city that will bring COVID vaccines and now flu vaccines to your home at a time that is convenient for you. Mornings, afternoons, evenings, weekdays, weekends. The mayor mentioned we'll do up to 10. But we've had a few questions, which I've loved. What if I have more than 10 people? What if my block club has gotten together and decided we want to get everybody up to date with COVID vaccines? We love it. We'll book back-to-back appointments. Our nurses are wonderful. They can bring everybody age 6 months and up to date. So give us a call or go to the website. Make, again, this potentially part of the holiday gift and celebration for your extended family. And then finally, you've heard me talking about Vax and Pax. Vax and Pax is short for vaccination and Paxlovid. Paxlovid is the medication that is available for people who have mild symptoms but are at high risk for getting really sick. People who are over 50, people who have underlying health conditions, if you get COVID, we want you to reach out to your doctor, or there are pharmacies here in Chicago that are called test to treat pharmacies, where you can go in and on the spot get a test. If it's positive, the pharmacist or your provider can take a look at your medications and, if appropriate, give you this medication. It really cuts your risk of being hospitalized or dying from COVID. These are two tools we didn't have back in 2020 when the most of our deaths were. And so just a reminder, whether or not you are up to date with your vaccines, if somebody gets COVID, think about whether they should take Paxlovid, because you've got to take it in the first 5 days of illness, but it's another important tool to protect our hospitals. And so just to summarize again, the things you can do to stay safe this holiday season. First and foremost, vax up, everybody. Mask up. You do not need to wait for a formal mask advisory to put a mask on in settings that may be crowded. I was at the Nutcracker last night, and somebody sitting next to me was coughing. Can I tell you, I was very glad to have my KN95 and be able to put it on. I think of my mask kind of like an umbrella. I don't carry it all the time if I don't think there's going to be a huge rainstorm coming, but I have it ready. And I put it on when I'm on the L, or I put it on if I'm in a crowded setting, or I'm worried the person sitting next to me might have a disease that I don't want. I encourage you to think of masks as another tool. If we issue an advisory when we move to high, put them on indoors. It means the risk is high. You can also back up, a reminder that keeping distance can help. You can open up the window. If it's not freezing cold, a little more circulation helps keep gatherings healthier. Obviously, wash up and then finally test up. And so with that, our numbers have not changed here. We continue to answer the phone 7 days a week to help handle any of your COVID questions. 312-746-4835, or visit the website. I want to wish you a happy and a safe holiday season. And with that, I think I'll bring up first Dr. Arwady. She's the Chief Medical Officer at Humboldt Park Health, and then we'll finish off with Dr. Luna with some remarks in Spanish. Thank you.
Good morning, my dear Chicagoans. I'm truly honored to join our esteemed Mayor, Lori Lightfoot, and Chicago's most beloved and respected doctor, Dr. Arwady, and a true champion of social justice and health equity, Dr. Luna. I'm the Chief Medical Officer for Humboldt Park Health, a safety net independent hospital on west side of Chicago. I am particularly thrilled to join today because I remember 2 years ago, on December 15, 2020, I joined our esteemed mayor at the Loretto Hospital to administer one of the first 5 doses of the vaccine. A lot of good has happened since then. In our own community, we have administered over 45,000 doses of the COVID-19 vaccine to our community. Over 90% of our staff and physicians are vaccinated against COVID-19. Dr. Arwady mentioned the Paxlovid. I want to echo that. I personally got our second episode of COVID-19 about 6 months ago. I took the Paxlovid oral, and it just accelerated my recovery. It was no more than just a mild cold symptom for me. We also run a post-COVID clinic since February of 2021. As you know, post-COVID problems continue to be there, so we can help our patients and our community recover from COVID-19 post-COVID syndromes as early as possible. Having said that, I would echo our mayor as well as Dr. Arwady that we have, with the vaccines and effective public health measures, we have made tremendous progress in the fight against COVID-19, but our challenges are far from over. In our own community and many socioeconomically disadvantaged communities, we see the COVID-19 positivity rate 2 to 3 times that of the city. At Humboldt Park Health, we have maintained that throughout the course of this pandemic. We know the threat of the triple-demic is greater this year because of somewhat loosening or wearing of the mask by the population. That is your influenza, RSV, and COVID-19. That very much remains as of today. I have personally, in our own hospital, seen an increase in hospitalization. Not severe, but increase in hospitalization of the patients to the extent that we have gone from 0 patients in-house to about 4, 5, 8, up to 8 patients in-house presently. And finally, one of the most challenging things that, from my perspective, has been the slow uptake of the new Omicron bivalent vaccine. We, in our own hospital, have been able to administer only 760 shots since it became available to us on September 15, 2022. The Chicago Department of Public Health has been extremely phenomenal in making the vaccine, the Paxlovid, the testing available to a community like ours, but there has been poor uptake. And of the 760, only 5 have been to children under the age of 5. And I believe the vaccine hesitancy continues especially in minority communities like the ones that we serve. So we need to double up on our efforts to make sure we get more vaccinated. And I applaud the department and the mayor's efforts to get vaccines at home to everyone. I believe this would help. So as we get into the holiday season, I would echo the message that the mayor and Dr. Arwady said. Please continue to exercise caution. Wash your hands. Use your mask as needed, get vaccinated, eat healthy, and exercise as much as you can, and open that window if you possibly can in the weather. And finally, I really wish you safe holiday celebrations, Merry Christmas, Happy Hanukkah, Happy Kwanzaa, Feliz Navidad, Feliz Año Nuevo. Thank you so much.
Thank you.
Thank you. Thank you for all that information. Now my part is going to be in Spanish. So, muy buenos días a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago, y hoy les traigo las últimas actualizaciones del departamento. Los casos están aumentando en Chicago y en todo el país. Aun cuando Chicago y el condado Cook permanecen en el nivel medio comunitario de COVID-19, se anticipa que desafortunadamente alcanzaremos las cifras de nivel alto tan pronto como esta semana o la semana que viene. La ciudad de Nueva York y Los Ángeles están en un nivel alto, además de 43 condados aquí en Illinois que alcanzaron ya ese nivel la semana pasada. En el momento en que Chicago y el condado Cook alcancen el nivel alto, emitiremos avisos de mascarillas y pediremos a todos los habitantes de Chicago de 2 años en adelante que usen las máscaras en los lugares públicos encerrados. Queremos proteger a los residentes, incluidos esos residentes mayores y más vulnerables, y aquellos con sistemas inmunológicos comprometidos. También queremos proteger nuestro sistema de atención médica para que no se vea abrumado con casos de COVID-19, lo que significa que si usted u otra persona necesitan atención hospitalarias por motivos que no sean de COVID, que haya capacidad para poder atenderlo en los hospitales. Sabemos que las reuniones de las fiestas es posible que ahí es que ocurre la mayor transmisión del virus. Por eso queremos recordarle a las personas que cuando se reúnan con sus seres queridos, disfruten de la compañía de los demás, pero de una manera segura. Hay medidas que pueden tomar para mantenerse seguros durante las reuniones familiares y actividades festivas. Por ejemplo, manténgase al día con las vacunas de COVID-19. Para la mayoría de los habitantes, eso significa recibir la vacuna de refuerzo actualizada bivalente que salió en este otoño. Esta vacuna ofrece 2 tipos de protección. Una contra el virus original y ahora también contra las cepas de Omicron, que son las variantes dominantes. Esta vacuna ha sido aprobada para todas las personas de 6 meses en adelante. Si no has recibido la vacuna desde el Día del Trabajo en septiembre, no está al día en las vacunas. Como recordatorio, las vacunas de COVID siguen siendo gratuitas para todo el mundo. Vacúnase contra la gripe también. Todas las personas de 6 meses en adelante deben vacunarse contra la gripe anualmente. Esto es especialmente importante para niños y personas mayores, porque son los que tienen más riesgo de enfermarse gravemente con la enfermedad. Cada año mueren personas a causa de la gripe en los Estados Unidos. Protéjase a sí mismo y a sus familias. Obtenga la vacuna anual contra la gripe. Considere hacerse la prueba de COVID-19 antes de reunirse con amigos o familiares para las fiestas. Las pruebas gratuitas de COVID están disponibles aquí en los Estados Unidos por correo. Cada hogar es elegible para 4 pruebas gratuitas y las puede solicitar con covidtest.gov. O puede llamar a 1-800-232-0233. Recuerde usar una mascarilla de alta calidad en los entornos concurridos. Estamos hablando de la N95 para personas que la estén utilizando, y recuerden que las mascarillas durante el uso de transporte público, ferrocarril, aeropuertos y viajes en aviones son especialmente protectivas. Lávese las manos con frecuencia. Evite tocarse los ojos y la nariz y la boca. Quédese en casa si está enfermo, aun si está vacunado, y hágase una prueba de COVID-19. Si está positivo, recuerde hacer aislamiento de 5 días y puede salir si está asintomático usando una mascarilla para completar sus 10 días de aislamiento. Y llame a su proveedor médico o su proveedor de la salud para que lo conecte con esas terapias como Paxlovid que salvan vidas en personas que tienen la enfermedad. Mejore la ventilación del hogar cuando se reúne en grupo, y esto es tan simple como abrir una ventana. Si está buscando una manera fácil de vacunarse en la ciudad, acuérdense que continúan siendo gratis. De personas de 6 meses en adelante, puede llamar para el programa de Protege Chicago al domicilio, donde vamos a su casa y vacunamos hasta 10 personas por vez completamente gratis. También en esa visita puede recibir la vacuna de la influenza completamente gratis. Cuídese, Chicago, y que pase una feliz Navidad. Now I'll leave you back with Dr. Arwady and the mayor.
Thanks, Dr. Luna.
Thank you.
Dr. Luna. Before I take questions, I wanted to also talk about briefly 2 other things. Unfortunately, this morning, we had a CPD officer who, all accounts are, took his life. What I will say is this is a tough time this season for everyone. And I think it's an especially hard time for those who are struggling with depression, with mental health issues. And it's important for us to make sure that when we know someone is having struggles, that we don't ignore it, that we reach out, that we offer our own assistance, and just to be a listening ear. Sometimes these conversations are difficult, but they're ones that are absolutely necessary and could be life-saving. What I'll also say is we've seen an unprecedented uptick in domestic violence cases this year, shootings and homicides. And for those who are unfortunately in one of those kinds of settings, in one of those kinds of relationships where you don't feel safe, please reach out. The domestic violence hotline is staffed 24/7, 7 days a week. There are resources that are available to help you relocate, to help you get to safety for yourself, maybe your children or other household members. But it's important that we make sure as a community, but also as individually, that we're reaching out to people in need. The last thing I'll say is I want to uplift and highlight, I think was a incredible call to action by President Vladimir Zelensky of the Ukraine last night. Great, rousing reception that he received from a joint session of Congress, and rightly so. And President Zelensky, I think, eloquently reminded us of a few important things in this time. First and foremost, the daily challenges that Ukrainian people are suffering at the hands of this murderous and unjust war by the war criminal, Vladimir Putin. He described, I think, in great detail the struggles for heat, for shelter, and just feeling safe in that community, in that country, given the nonstop rain of missiles coming from Russia. I think what he also talked to us about is the courageous and resilient spirit of the people in Ukraine. He talked about the fact that maybe people will be celebrating the upcoming holidays by candlelight, but that they will be celebrating. And that, I think, really spoke to me personally. He talked about the heroic soldiers on the front lines in the battle to save the soul of Ukraine and the daily sacrifices that they are making. But he also, importantly, called upon the United States to never shrink from its responsibility as a world leader in an effort to make sure that freedom and security are the rights of all democratic countries. And Ukraine, of course, is top of mind. So I was very impressed by what I saw and what I heard, and I just want to make sure that we are continuing to do what we need to do as a community that has a long tradition of people from the Ukraine and other parts of Eastern Europe being here in our city. I'm extraordinarily proud of the work that's been done by the Ukrainian community here on the ground, by the Polish community, and others who have rallied over these last 10 months to make sure that Ukrainians who are coming here to resettle are able to do so, but also that we are not leaving behind the people in the war zones in Ukraine to make sure that they've got their basic needs met. And we will continue to do that as a city. Now I'm happy to take your questions.
Thank you, Mayor. We'll kick it off with Craig Wall, ABC 7, who's the only reporter of the day.
So I hope you'll indulge me with a couple extra questions, maybe channeling somebody in.
Apparently you're the pool reporter today, Craig.
Apparently
so.
Good to see you, Mayor, and glad you're feeling okay. Let me just first ask you, just on that note, how are you feeling it, and what were the worst symptoms that you endured during this time?
Well, I'm actually feeling just fine, and I can't say that I had any worse symptoms. When I got the positive test, I was frankly quite shocked. I had a little fatigue the next day, but after that, I've been going kind of full tilt. And I will tell you, my staff doesn't think that I'm sick because we've had nonstop Zoom meetings, conversations. I've been catching up on reading memos and briefs, and reaching out to people. But I appreciate all the well wishes that I've gotten from people across the city. But I feel good, and I really do attribute that to the fact that I have gotten the Omicron bivalent booster. I think it's made a huge difference. Much different experience than what I had in January when I previously tested positive.
I think I remember that too. Let me just ask you about the mask advisory that you're talking about.
About what, I'm sorry?
The mask advisory.
Yeah.
How are businesses, what are you encouraging businesses to do as they try to navigate this? Can they still do mask mandates? And how do they work through all this?
Well, look, I think what we are expecting when we go to high is to say to all Chicagoans, when you're in a public space, whether you're at work, whether you're going into a restaurant, a gym, or whether you're going to entertainment like Dr. Arwady was at last night with the Nutcracker, wear a mask. We think that that's a smart way to go. Now, we'll leave it to individual businesses as to whether or not they want to mandate that for everyone, but we do think it's smart, given what we're seeing is the rise in cases of COVID, but also flu and RSV. It's really important that people take the necessary steps to protect themselves. Look, no one wants to wear a mask. I don't want to wear a mask, you don't want to wear a mask, but I'm wearing my mask, one, to follow the CDC guidelines. I wore that through day 10 in my recovery from COVID. But beyond that, I really do think it's important as we move inside for people to be conscious of the fact that the inside conditions are a breeding ground for viruses, and COVID-19 is no different. I don't know if Dr. Arwady, if you want to add to that.
Just briefly, we will have signage available. We'll be working with Business Affairs and Consumer Protection to make sure that businesses have signs that they can put up, encouraging masks. Certainly if there are settings that choose to require their staff to wear masks or others to wear masks, that is within their, that is certainly something we encourage. I can tell you at the Chicago Department of Public Health, everybody will be required to wear a mask indoors, for example, if and when we move to high. We are at high. We know the risk in the general population is high. We know that we're also starting to see some real impacts on our hospital setting. I will tell you, it is that hospital capacity that we are the most worried about. Right now, just over 5% of our hospital beds across the whole system are taken up by patients with COVID-19, as you heard from Dr. Agarwal. If and when we see that number get above 10%, particularly if we're seeing a flu surge and other problems, that's when we know we start to really, our hospitals start to lose the ability to take care of people who are having a heart attack or, having an accident. And so if we're getting above that level, it's going up quickly, and we start to see major problems, that's where we might consider sort of legal mandates. But the advisory would be the next step. And I hope we never need to do anything further than that, and that people would do the right thing while we are at a high level. And some people have also said, why didn't you already do this? We do this based on local data. I want to make sure that people hear that we know folks don't love wearing masks. When we say put the mask on indoors, we mean it. And we mean it because our local risk has hit a high enough level that your risk of just being out and about and living your life, the risk of acquiring COVID is high, and we've got to take that step to help protect the hospitals. So I really feel strongly about doing it based on our local data, and then that advisory would come off when we fell back below the high level.
If I'm not mistaken, the CDC updates their guidance on medium or high risk or whatever every Thursday night.
That's correct.
So two-part question on that. Are you expecting the CDC could move Chicago, Cook County to high tonight?
I think it is unlikely tonight, just based on where we are. But I do think it is likely in the very short time period coming here over the holidays, which is part of why we wanted to lift up the conversation right now.
And I always hate to ask this question, but it feels like we always have to ask are you anticipating, a surge in cases post-holiday because of all people gathering, and is that likely to be the trigger for high here? Yeah,
so we know that the holidays are a time that makes our COVID rates go up. We have seen that regularly. We saw an increase in that week after Thanksgiving gatherings, for example. I expect to see a similar increase in this time period. That's part of why I feel relatively confident that we probably will move to that high level. Again, I want people to gather. I want people to have their celebrations, doing some of these other things, staying home if you're sick, testing in advance of gatherings. That can help limit some of that. And then if people are up to date on their vaccines, if COVID hits, we don't stress the hospitals in the same way. And so that's what's different than where we were, say, 2 years ago around the holidays.
I just have one more question. Mayor, would be off topic, just election-wise. Yesterday, as you're probably well aware, Willie Wilson and Jamal Green had the challenges to their petitions dropped, meaning they will be in the race. As of now, that means there are 7 black candidates in the race. What concerns do you have about how this could divide the black vote and how it might impact your chances for re-election?
Well, look, I really don't have concerns as long as we keep doing what we need to be doing, which is reaching out into not just Black Chicago, but all over Chicago, and telling the story of how we've delivered for Chicagoans over these last 3.5 years, talking about the fact that we brought economic development and ability to build wealth into areas of our city, black and brown in particular, that really haven't had that kind of boost from City Hall in decades. If we keep telling the story of what we're doing around affordability and housing, helping renters, but also helping homeowners and building additional options around affordable housing. If we keep telling the story of what we've done to really stitch back together the social safety net, if we talk about what we've done and the progress and how we've done it to really make improvements on public safety. We talk about why our economy is the strongest in the nation, and how we are seeing companies flock to Chicago, seeing existing Chicago companies expand their footprint. There is no one else in this race that has a record of accomplishment like we do over these last 3.5 years in the most difficult circumstances I think that any mayor in modern time has faced, but yet we have continued to deliver every single day for Chicagoans. So my focus is on telling that story and listening to Chicagoans about what we need to continue to do to help them in their daily challenges to move beyond COVID, move into prosperity, continue to make progress on public safety, continue to make progress on all the social issues that we've been talking about nonstop since the beginning of my administration. So challenges come what may, where I need to be is where I am right here, which is doing my job and making sure that as an administration, we continue to deliver for Chicagoans. And I'm confident that if we do that and that story is told and people understand what we've been able to accomplish, particularly under the most daunting of circumstances, that we'll be victorious on Election Day.
I feel like Columbo here, but just one more thing.
You said just one more thing.
I did grow up watching that show.
And I appreciate the Columbo reference.
Yes, I thought you might. After the holidays get over, this campaign is going to kick up.
Yeah.
People are going to start spending money on TV.
Well, we already are up. But
You're the only one up right now, but others are going to be joined in. Are you expecting this campaign is going to get down into the mud? Is there going to be a lot of mudslinging? Is it going to be kind of ugly?
Well, I hope not. But there are stories to be told. When you put yourself out there as a challenger to an incumbent mayor, I'm not going to just sit back and wait for others to do their job. We will, and as we have been, really defining and challenging our opponents so that people have an understanding of what the field actually is like, and not just names and not just sound bites. Somebody who puts themselves out there as a front runner, why aren't you answering questions, basic questions from the media? Somebody who says, I've got the cure for all that ails Chicago, well, prove it. If you've been an elected official for decades and you have no body of work to demonstrate what you were actually able to accomplish, and you match that up against just 3.5 years and the stack of things that we've been able to accomplish under the most difficult circumstances, I think that tells a story that people are going to want to hear. So I don't think it's got to be about mudslinging, but it is got to be about making sure that, on the one hand, I keep talking to Chicagoans about what we've done, what we accomplished, why it is that I deserve 4 more years, what our positive vision is for the city, but also challenging the opponents, not just to stand on the sidelines and lob bombs, but tell us what you're doing, what's your plan. And importantly, I believe very strongly, past this prologue, you've got people that, if you look at them collectively, have been elected officials for decades and decades and decades. I want them to, and I want, frankly, to urge the media, ask them what their positive accomplishments are for residents in this city. Those are fair questions to ask. That's what campaigns and elections are all about. And we will make sure that we keep pressing and making that case.
Thanks a lot, Mayor. That's a wrap, everyone. Have a great day.
Happy holidays, everybody. Thank you.